This is a retrospective cohort study, observational study, looking at approximately 110 children. The two groups are equally divided. One group was exposed to the transition navigator, and the other group was not exposed to the transition navigator. And we collected data 1 year prior to the last visit to the children's hospital and 1 year after the first visit to the adult hospital. And we look at three major outcomes. First one was loss to follow-up. Second one was medication adherence. Third one was appointment attendance. And then the fourth one was hospitalizations. We found that there was a significant reduction in the proportion of patients who were lost to follow-up. We also found that there was an increase or a sustained to good adherence to medications. There was also a increase or sustained good attendance to the clinic appointments. And by good, we mean greater than or equal to 90% of the time. What we did find that has no difference was the hospitalization. So for us, this is a full-time job. In terms of the size of our program, we have we transition around 50 to 60 patients a year from the pediatric to the adult hospital. The job itself is a social worker. She's a young, energetic social worker with a master's in social work. What she does is that she starts following these patients from the age of 12. By the age 17, we begin a transition program where both the adult and the pediatric hematologists will participating in seeing the patients in the clinic. And depending on whether the patient is ready to transition or not, and that's usually determined by a number of factors that we have. We have a little checklist that we go through as well. And then this checklist includes both medical and non-medical issues. And what the Transition Navigator does is that she ensures that a lot of these issues are sorted out, especially from the psychosocial point of view. For example, any depression or anxiety that the patient experiences, their stress with obtaining reimbursement, insurance, because often there could be a change in terms of payers when the patients become an adult. Transition to an independent living, assisting them through these, assisting them in finding a job, helping them with applications for bursaries and scholarships and loans for either school or for work, helping them connect with their local resources. So she's responsible for all that.